It's been kind of an interesting news actually for the dental week. So let's talk about a few things that I think really are pertinent and folks need to know about. Maybe slightly under the radar for a good number of our folks, but the DEA released a new requirement that you all should be paying attention to. It's called the MAT Act, MATE. And that is now requiring those of us who use our DEA license on any frequency or basis to write an opioid prescription. You now will be required to attend an 8-hour opioid training course in order to allow you to continue with the process of writing your opioid prescriptions. This is in addition or on top of your requirements from your state as well. Although I will tell you at this point, if anyone is advertising to you that they have DEA approved 8-hour courses, there is no guidance yet to approved providers like the ADA, for instance, to provide this 8-hour course, what topics need to be included, what kind of ticks the box off to make this a required course. But here's the real kicker. This requirement goes into effect at the end of June. So here we are with a new requirement and it's not even legislative, a new requirement in order to keep our DEA license active and in good standing with a additional 8 hours of training that are due in 3 months. Buckle up, folks. I will keep you posted as courses get approved. I kind of think that this may get extended as per usual course of the government when these things get approved and then they realize that some of the infrastructure isn't in place. And these large institutions need time to be able to deploy the types of education required and to credential docs. I also think it's important that this is another one of those types of regulations that often has a lack of oversight. So there is noted language in this particular act that doesn't have a lot of clarity on whether or not doctors will be audited or reviewed for this particular language. When I was discussing this with another provider just the other day, I said, this is the scenario that I foresee actually becoming the issue. You write a prescription for a patient for a legitimate prescription for a surgery you've just completed. They happen to be an addict or using it on the street as well. They get into a car accident. The last known opioid prescription came from your office. And all of a sudden you're getting a call from an attorney and from the DEA wanting to see when you attended your 8-hour required course. You also probably will have to report that you have attended it when you go for your DEA renewal. No clarity yet what that will do for those of us who are due for renewal this summer. I'm just going to keep you posted, guys. I really don't know much more than you do. Except that we're getting information and that there is no clarity on the approved courses currently out there. I'm already seeing advertisements in email about courses that may be available, but please understand that the DEA has not provided enough direction yet for these large conglomerates to be able to get their education together. I know the AGD, the ADA, and other institutions are currently looking at what it will take, what would be required to be included in the 8-hour course, but more details coming. There was also an interesting piece of news that came out this week as well. We've talked about the Health Resources and Services Administration, or HRSA, in the past. They put out an interesting report at the end of Q1, basically highlighting a significant shortage in dentists in the workforce, along with other medical providers and mental health and physicians as well. And the interesting thing is that they noted that we would need another 100,000 dentists in the marketplace in order to address the current shortage. I don't know about you, but I'm processing that particular data point. Also looking at the current trajectory of the cost of dental education as a whole and trying to understand the actual demand for dental services along with the deficit of dentists where we need them. But just be aware that now the government is looking at these shortages in the dental workforce area to figure out how they can inject additional dentists into the community, good, bad, or indifferent. Also noteworthy, we now have 13 states allowing mid-level providers to be able to provide non-reversible procedures to patients. So this could be an interesting couple of years to see how all of these things come together. Lastly, and a bit of an interesting news and more of a PSA, frankly, as I just consume the data, I don't really know how to process it and move forward. But there have been multiple cases now, two in fact, of patients on clindamycin acne topical treatments that have had anaphylactic reactions to IV clindamycin being administered during an oral surgery procedure. So fairly typical that antibiotics might be onboarded through IV when we're doing large oral surgery procedures. I think that's a common practice for a lot of oral surgeons. I think that the question then becomes how much are these antibiotics in the marketplace and how do we quantify the exposure rate? It would seem that because the patients had been on long-term clindamycin topical application, when given it in IV form, it triggered an anaphylactic reaction. Luckily, the story has a positive ending. The doctors were very aware of what occurred and reacted quickly. So no long-term consequences have happened, but certainly a data observation that warrants a little bit more understanding as we do constantly monitor and understand the risk of a growing amount of antibiotic resistance and allergic reaction as it's being introduced to the population. So with that, that's the news.